The most important thing about understanding what a rotator cuff tear is to first understand what the rotator cuff does. So the rotator cuff is a common tendon that wraps around the ball of our shoulder, and multiple muscles, 4, attach to that common tendon and compress the ball against the socket. It allows the shoulder to work perfectly central along the socket while the other muscles of your shoulder move it around. So without a functioning rotator cuff, your ball and socket don't work well and you get pain. So a rotator cuff tear is one of the most common ailments we get as we age. There are 2 kinds of cuff tears. There's the acute or traumatic cuff tear, usually a result of a bad fall, or there's a chronic cuff tear, which happens over time. The rotator cuff fails as a result of age, or I wouldn't say overuse, but misuse. And how you treat them is vastly different. An acute traumatic cuff tear, in the vast majority of patients, should be fixed surgically. The caveats to that would be if you are a much older patient. So older patients, and what I mean by older is over the age of 70, most of those patients would do better without surgery, actually, would do better without surgery. And with physical therapy and injections and medicines, they can get some function back. In the younger patient, you're much more inclined to fix them in order to restore their shoulder function. Now, chronic cuff tears, on the other hand, they don't always need surgery either. And the main thing that determines whether a patient with a chronic cuff tear needs surgery is the age of the patient, because younger patients tend to heal better than older patients, the function of the patient, and number 3 is the MRI. We get lots of MRIs, especially in the shoulder, because there are certain characteristics on the MRI that predict success of repair. And those include how the muscle looks, how the tendon looks, what the joint looks like. And there are certain criteria that might predict that you would not do well with surgery and therefore would do something conservative or non-operative. So when you have a tear, it's not that tear always equals surgery. It depends on the type of tear, how bad it is, the age of the patient, and the function of the patient. So a lot of times we see patients as in referral who come in really nervous that they have a cuff tear and that they're going to need surgery. And that's just not always the case. So the surgeon will talk to you about all these different factors and determine if surgery really is best, because it might not be the best thing for you.